Have you ever wondered who exactly plans the response when a massive health crisis hits? Like, who is actually pulling the strings? Well, welcome to this explainer. Today, we're diving straight into exactly how public health professionals engineer solutions to these incredibly complex, massive crises. We're looking directly at some really fascinating source documents that pull back the curtain on how experts are trained. It shows us how they look at our world, diagnose its most pressing issues, and systematically design these massive, life-saving interventions. So, here's our agenda for today. We're looking at 5 key areas. 1. Inside public health training. 2. Unlocking behavior change. 3. Stopping communicable diseases. 4. Tackling environmental waste. And 5. Measuring real impact. Let's get right into it.
Section 1. Inside Public Health Training. See, what we're exploring today isn't just, abstract theory. We're describing and explaining exactly what we found in 2 highly rigorous comprehensive exams. These were taken by public health graduate students at the Adventist International Institute of Advanced Studies, spanning 2021 and 2024. And these specific documents are just incredible because they don't just ask for definitions. They force students into highly realistic, high-stakes scenarios. Exams at this level are literally designed to simulate the intense, high-pressure environments of real global health agencies. I mean, places where a bad plan can literally cost lives. So we're going to treat these exam answers as the ultimate master plans for crisis management.
It really all boils down to the single, massive question. How do you systematically build a healthier society from the ground up? Because let's face it, human nature often resists change, right? We stick to our habits even when they're harmful. So as we'll see unpacked in these sources, public health isn't just about telling people what to do. Actually, scratch that. It's more like engineering an entire environment where the healthiest choice naturally becomes the absolute easiest choice.
Section 2. Unlocking behavior change. The 2021 exam perfectly illustrates this challenge using what's called the health belief model. Now, this model is a brilliant framework that decodes why people make the health choices they do. Think about something as simple as wearing a seatbelt. Before a person chooses to buckle up, they have to truly perceive that a car crash is a real threat, that the threat is severe, and that the benefit of wearing the seatbelt outweighs the, minor inconvenience of putting it on. The model tells us you can't just throw raw facts at a population. You have to understand their underlying attitudes, their perceived risks, and the specific personal barriers blocking them from taking action. To see this in action, the 2021 exam presents a scenario involving a school health coordinator dealing with low COVID-19 vaccination rates. The source material lists 4 distinct barriers a health educator faces. You've got parents refusing the vaccine because they believed the virus was mild, or they trusted their children's immune systems, or they were relying on alternative treatments like daily ivermectin, or maybe they just feared the vaccine was unsafe. Each of these barriers requires a completely different communication strategy. Overcoming the belief that a virus is mild? Well, that requires data on severity. But addressing a fear that a vaccine is experimental? That requires deep, empathetic education on clinical trial protocols. A single blanket message simply won't cut it. So how do you actually solve a deeply rooted behavioral challenge like that? The exam breaks down the toolkit, explaining that planners have to assess 3 main factors to drive real change. First up, predisposing factors. This is your baseline knowledge and attitudes, basically what you already believe. Next are enabling factors. These are strictly logistical, like you can convince someone to get a vaccine all day long, but if the nearest clinic is 50 miles away and they don't have a car, the behavior isn't going to change. Finally, reinforcing factors, which are all about peer pressure, family dynamics, and culture. Whether you're trying to get folks vaccinated or helping a municipality quit smoking, which, by the way, was another distinct scenario in these exams, you absolutely have to build interventions that hit all 3 of these pillars simultaneously. Otherwise, the whole shebang collapses. Section 3. Stopping communicable diseases. Now, in the 2024 exam, the student takes on a truly terrifying scenario, stepping in as the director of a non-governmental organization combating infectious diseases. Based on community assessments, the student explicitly makes the assumption that they're dealing with a deadly cholera outbreak in a local province. A cholera outbreak moves blindingly fast. It contaminates water supplies and causes severe, life-threatening dehydration. The stakes here literally couldn't be higher. To stop it, an expert doesn't just run in blindly handing out medicine, no way. They deploy the Precede-Proceed model. This is an incredibly thorough 9-stage framework. The student notes in the exam that 90% of the success of this program actually depends on the rigorous planning happening in the first 5 stages, the Precede part.
Why do we need a social and behavioral assessment for a biological disease like cholera? Well, because human behavior, like where a community washes their clothes or sources their drinking water, is what drives the spread. Skipping these early analytical stages and rushing straight to implementation is a guaranteed recipe for disaster in a public health crisis.
Once that meticulous planning is complete, how do you actually deploy the solution? The student uses a classic business marketing mix to essentially sell sanitation and hygiene directly to the community. They are literally treating health education like a major product launch. The product is the life-saving workshops. The price is kept free for the people, while they secure funds to rebuild latrines away from vulnerable water sources. The place strategically utilizes trusted community hubs like churches and local schools. It just goes to show that saving lives on a massive scale requires just as much strategic, targeted marketing as launching the next big tech gadget.
Section 4. Tackling environmental waste. Okay, this number is staggering. 1.5 kilograms. Take a second to really think about that weight. According to a grant proposal drafted within the 2024 exam, this represents the amount of solid waste an average single person in Minsk, Belarus, disposes of every single day. The student identifies that this intense level of modern consumerism is completely overexerting the local waste management systems. It's a slow-moving crisis, sure, but the compound effect of that much daily waste per person quickly transforms into a massive, irreversible environmental hazard. To put that into perspective, over a year, that's over 1,000 pounds of trash for just one person. To combat this mounting crisis, the proposed strategy is incredibly smart. Instead of just lecturing adults who are kind of already set in their ways, the grant proposal heavily targets school children. The goal is to teach them these 5 distinct principles to fundamentally alter the community's consumer habits right from a young age: refuse, reduce, reuse, repair, and recycle. Think about repair for a second. In our modern throwaway culture, fixing a broken appliance is almost a forgotten art, right? By baking these specific concepts into the minds of youth, proper waste management shifts from being a chore to a natural, lifelong habit. The ultimate strategy here is that these kids will eventually take these principles home and educate their own parents. And, you can't just teach the kids and walk away. The intervention builds methodically over a 12-month timeline. The student maps out a full year, systematically moving from an initial grassroots needs assessment in January, all the way up to massive environmental policy changes by December. The proposal even goes as far as advocating for lower taxation for organizations that properly segregate their waste. It's a brilliant, multi-tiered attack on the problem, effectively combining ground-level youth education with powerful top-down corporate incentives.
Section 5. Measuring real impact.
A successful, measurable plan requires a very strict budget and clear metrics. Take a look at this $200,000 layout proposed for the Minsk Waste Management Project. Notice how it heavily prioritizes the equipment category, eating up $130,000 of the total budget, while promotion is just $5,000. Why such a stark difference? Because, let's be honest, talk is cheap. You can educate people all you want, but if you don't actually buy and install the 5,000 special segregation recycling bins they proposed, physical change is absolutely impossible. You have to explicitly fund the environment you want to create. But evaluating success in public health isn't like a standard laboratory science experiment, especially when you're dealing with communicable diseases. The source text points out a fascinating ethical dilemma regarding the cholera outbreak methodology. When evaluating deadly outbreaks, professionals rely on what's called a quasi-experimental design. See, it is completely unethical to randomly deny life-saving cholera education to a control group just to see if your new program works. That's a huge no-no. Instead, they cleverly compare their post-intervention data to neighboring cities that naturally didn't receive the intervention. It's a really smart workaround to gather hard scientific data without actively risking human lives. So that brings us to the end of our deep dive into these remarkable comprehensive exams. We've explored how experts decode complex human behavior with the health belief model, how they map out thorough 9-stage interventions to stop cholera, and how they strategically budget for citywide infrastructure. The most empowering takeaway here is that public health isn't just some mysterious field reserved for experts in distant laboratories. The foundational frameworks are completely accessible. Armed with powerful tools like the Proceed model and the 5 R's of waste management, how would you go about engineering a solution for a crisis in your own community? Thank you for joining me for this explainer, and I hope this deeply changes the way you look at the complex systems operating all around us.